So we're going to spend a couple minutes just talking about a section of the booklet that says risks of total joint surgery, and this pertains to our surgical consent form that we go through with you in the office before you have a joint replacement. At first glance, it's very scary for patients to read a 3-page consent form that's written by the attorneys that has every potential complication under the sun that could happen to you. But it was written by attorneys, and you should take some comfort in the fact that we do 8 of these a day, and our complication rate is exceedingly low. So with hip replacement in particular, there are obvious risks. There are risks of us changing your leg length, dislocating the total hip, breaking your femur, blood loss, nerve vessel damage. All these different things can happen, but again, the good news is it is incredibly rare for that to happen. The leg length issue and the dislocation risk has almost been taken care of by the anterior approach. With the anterior approach, we use x-ray guidance to make sure your parts are properly sized and positioned, and we'll go over all that with you on an individual patient basis, but we actually try and add a few millimeters of length to your hip to restore it back to where it was before the ball and socket became worn out. The risk of fracture is pretty low in our hands because we do so many of these things, but anytime you're hammering in metal parts into a skeleton, there's a risk of cracking the bone. It's a higher risk, obviously, if you're a little old person with very poor bone quality with osteoporosis or osteopenia. But again, that risk is very, very low. Some of the more common things that are risk factors that we treat for are infection and blood clot. On the infection side, we do our best to avoid infection like the plague. Our infection rate is very low, probably half of the national average, but we go out of our way to try and avoid getting an infection in the first place. How do we do that? Lots of things. So preoperatively, we do some screening with your doctor to make sure that your metabolic system is in good order, your nutrition is in good order. If you're diabetic, we want to make sure your hemoglobin A1C is low enough that you have good glucose control. We send you for all these tests. In addition, when you come and see us preoperatively, we give you Bactroban nasal ointment and a special wash that you get at the drugstore. You get this HibaCleanse wash where you wash the affected surgical area 5 days leading up to surgery, and you put the Bactroban nasal ointment in your nose. Those things are designed to reduce your risk of infection. Beyond that, once you come into the center, there's a lot of things that we do behind the scenes that you don't even realize. We wear special surgical hoods. We use dedicated teams. We have laminar flow in our operating room, which is special airflow. We minimize the traffic in and out. We have special precautions that we use in the operating room, including special antibacterial washes. So once the final implant is in place, we wash out the inside of the joint with this antibacterial solution before we close. So all of those things are done to mitigate the risk of infection. So we do our best on that front. With respect to blood clots or DVTs, we give you the portable calf compressors. You wear the stockings, the thigh-high stockings that are anti-embolism stockings, and then you go on some type of blood thinner. It depends on a number of different factors. You know, whether if you've had a history of clotting or obesity or cancer, there's a bunch of different risk stratifications, including smoking. If you're in a higher risk category, we may use an injectable type of heparin for a couple of weeks. If you're in a lower risk category, you may just take aspirin twice a day, and we'll figure out what's best for you. So all of those things come back to the informed consent. So in the informed consent, there's basically 3 sections that I tell people about. There's the section that says all of these bad things that can happen to you and all the risks of surgery. You need to read those and understand them, but again, the risk is very, very low because of our expertise and our volume. There's another section in there that says something about off-label and FDA. That's not really in there for primary hip and knee replacement. That off-label FDA section pertains to redo hip replacements and knee replacements. Let's say you had a hip put in 20 years ago and the manufacturer doesn't exist anymore, and I have to go in and match up company A with company B and come up with a solution. That's technically off-label. It's done every day in the United States, but we just make you aware that we might have to be creative. Doesn't really pertain to first-time hip and knee replacements, so you don't need to worry about it, but we put it on our consent because we do deal with a lot of complicated cases. The last section of the consent, in general terms, is a disclosure. It basically, in a paragraph or 2, says that I've told you that I'm a teaching surgeon. I frequently have visitors in the operating room. I teach surgeons all the time, and so they may be present and observing part of your surgery. I get paid to travel and teach, and I'm a royalty-based surgeon where I also get paid some royalties for some of the hip and knee implants that I've designed. but I don't get paid anything on any of my own patients. So there's something that's put in there in terms of regulatory bodies that say surgeons can't have a financial benefit from the implants that they put in on their own patients, and it's really done to safeguard patients against potential unscrupulous behavior, and I can't imagine it happening, but it's there to protect you. So that section basically says to you in a nutshell, I've disclosed to you that I travel and teach, I get paid for some of that teaching, but again, it's on the consent form, and that's basically it. So read through the consent form. If you have any questions, please ask us, and we'll answer them for you.